It seems I have more than 3 minutes before the poster presentation, but don't worry, I'll stick with the 3 minutes. Okay. Hi, everyone. So I'm a research coordinator for Abigene's program that I will introduce today. And the leader for Abigene's program is Associate Prof. David Godler. So here we go. Yeah. So as you know, there are more than 100 rare genetic diseases, including Prader Willi syndrome. And any changes in DNA sequences, it will cause alteration in the DNA methylation. And we are using this concept for screening or genetic diagnostic testing. We have developed Abigenes or abigenomic newborn screening to screen for, how to go back? Yeah. So we developed Abigenes to screen for few conditions, but not limited to those conditions, including Prader Willi syndrome, Fragile X syndrome, and other conditions. And actually, we have established pathway for expanding Abigene's project to other conditions with little added cost. For Abigenes, it employed first-tier testing, which is DNA methylation on small amount of blood spots from the newborns. And then those with positive result, we run second-tier confirmatory testing using DNA, digital PCR, and then DNA sequencing as well to confirm the findings. As you know, Prader Willi, it has effective treatment, at least for the symptoms, which is growth hormone. And Prader Willi syndrome, it doesn't currently included in the newborn screening program. So for Abigenes, the recruitment and biospecimen samples, including blood spots, recruited from two sources. The first source is GMV cohort or Generation Victoria cohort. So for GMV, they recruited newborns born between October 2021 to October 2023. So far, I think they have recruited almost 50,000. So this is the first source. The second source, it's other 50,000 from those consented for de-identified research from VCGS, which is Victorian Clinical Genetic Services. So currently, I think for GMV, they have recruited 48,600 so far. So the GMV also, they have an app called GMV and Me, and they are collecting survey from parents at different waves, at baseline, 6 months, 1 year, 2 years, 3 years. And so for GMV, for screening those conditions, including PWS, we started the preliminary testing, and actually officially will start screening from September for those conditions. And the aim of the study to determine first the prevalence of those conditions and also to assess the cost effectiveness comparing between our workflow and standard of care genetic testing as well. So those just quick summary statistics from GMV cohort. So far they have recruited up to April 47,000 plus, but it reached more than 48,000. As you can see, there is diversity in the GMV cohort. So almost 62%, the primary parents born in, I don't know why it goes, born in Australia or New Zealand, but there are some primary parents born from other countries. Almost 50% male from GMV cohort, and there is few conditions, either unisex or unspecified. There is few twins as well, and even triples. And yeah, I think there is about 4% preterm, as you can see. And to show the diversity, again, there is 20% with the less disadvantaged groups or families. So we have poster outside, and if you are interested, this is the QR code for our Abidjan's program. Thank you.